everybody, and thank you very much for the scientific committee inviting me here. It's a very nice opportunity to be with you. I talk on about medical education, focusing social responsibility of the medical education. There is an ongoing trends for decades in Turkey, I think not only in Turkey, all around the world. The medical specialization exam, we call it TUS in Turkey, this year resulted core medical specialties such as general surgery, internal medicine, pediatrics, obstetrics and gynecology, cardiovascular surgery have either been filled very, very low scores or left vacant. These branches demand continuous personal interaction with patients, characterized by irregular hours, nighttime on calls, high patient volume, high legal and physical risks, and relatively low incomes. And there's a growing trend toward more comfortable branches, lighter on-call duties, higher income potential, easier transition to the private sector, and less stress. Explaining this picture merely as a matter of personal preference or comfort seeking, this is insufficient. This is the result of marketized healthcare system, no liberal conception of the individual. Medical school becomes an investment and specialization choice a return on investment. In near future, physician shortage in surgical specialties, insufficient specialists in emergency departments, service delivery problems in public hospitals, poor and rural areas may be left without enough skilled doctors, fewer doctors choose less profitable but essential areas like general surgery. The few doctors in high demand field face extreme stress and workload. That means loss of social mission, and medicine becomes more about profit than public service. The medical profession has been reduced from a public responsibility to a protocol executing, efficiency-driven technical expertise. Today, doctors are not merely making individual choices. They are being ideologically reshaped to align with the system through performance metrics, patient satisfaction scores, and productivity charts. Like the ancient Greeks, there are two types of doctors, slave doctors and free doctors. Today, doctors are slave doctors, a non-questioning, non-resisting figure, focused solely on personal exit strategies, complicit with the system's functioning. Since 80s, neoliberal policies and the health transformation program accelerated privatization and commercial incentives in healthcare in Turkey, like in many other countries. Growth in private hospitals and market-driven reforms undermined preventative care, weakened public capacity, and shifted many patients toward private providers. The systemic results, a healthcare landscape driven by profit, sidelining public health goals, and makes weak Turkey's 8-year heritage of the preventive medicine, like in many other countries. And there are some extras for Turkey. Mobbing at work, political interference, unfair promotion systems, favoritism, nepotism, loss of professional respect, exhaustion and burnout, fear of lawsuits, even violence. Last 10 years, we lost 20 medical doctors killed by patients or patient relatives. So the medical specialization exam showed us this is not just an exam, it's a domain where the ideology wins and society loses. We are living in a time of crisis, climate change, deadly pandemics, and growing risk of wars. Scientists call this the Anthropocene, an age where humans are damaging the planet more than ever. By 2100, much of Earth could become unlivable. COVID-19 showed how weak medical system can be, not just from lack of science, but from bad political decisions by authoritarian leaders like Trump, like Boris Johnson. Many lives were lost because of this. Many lives were lost because of this. Medical education needs to look beyond just science. Medical education should include politics, economics, social systems to fully understand and respond to global health crisis. Some medical teachers say social justice is just an ideology, not the really part of the healthcare. They think topics like climate change, inequality, gun violence, and bias are not closely related to treating illness. These teachers believe focusing too much on social issues weakens science in medicine. They argue that doctors need strong science training and that medical education should reward the most capable students. But COVID-19 showed us how unfair the system is. Minority and poor communities faced high risks of getting sick and dying. Saying doctors should only focus on clinical care is not just limiting its dangers. Doctors are some of the most trusted people in society. Today, most health problems like diabetes, heart diseases, cancer, mental illness, they are all from social issues and class differences. But medical education doesn't prepare doctors to deal with these real causes, even though they make up about 80% of what patients come in with. So we, at least some of us, have been asking for medical humanities in schools for years. Some courses were added, but the overall system hasn't really changed. Medical humanities come from bioethics, which try to make medical education more human and fair. The goal is to help students become more empathetic, compassionate, caring, not just competitive. They also teach better listening, stronger communication, a sense of right and wrong. Medical education often focuses on science, technology, engineering, and math. There is not enough space for critical thinking, creativity, or understanding complex human experiences. We need understanding that medicine has deep roots in social justice, asking deeper questions like what really is health? What do you mean by medicine? Being able to lead good meetings, being coalition with people from all backgrounds, teach hard-earned lessons and truly move people. Socialization process in universities and in our medical faculties as a process of fostering political and intellectual subordination. The process ultimately produces obedient thinker, highly educated employees who do their assigned work without questioning its goals. And many studies show that traits like authoritarianism, social dominance are very common in medical education. One consequence is that truth, evidence, and science fall prey the language of mystification and legitimacy, widespread ignorance, and further collapse of morality and public courage. This is a couple of days ago. Florida to eliminate all vaccine mandates, including for schools. It's happening in the United States. Can you believe this? The pandemic showed us some harsh truths, like people waiting in long food lines, mass deaths, and rise of crueler ideas like social Darwinism and racism. It revealed how politics can feel like war, where thinking is discouraged, protest is silenced, surveillance becomes normal, and ignorance is treated like a strength. Did anyone talk about this? The role of whistleblowers today, hospitals, can be compared to that of suicide bombers. If you wish to report any malpractice or any misconduct or corruption in your hospital, you do not have a chance to survive. Doctors today are drawing in debt, stuck in rigid systems, and afraid to speak out because they know the risks, losing their jobs, their license, and their reputations. Whistleblowers are often treated like outcasts. Even during the pandemic, most doctors stayed silent. The few who spoke up were often fired or pushed aside. Medicine became a deeply conservative profession. Young people go through over a decade of training that is intense and unforgiving. They are shaped to follow rules, not challenge them. The system, shaped by neoliberal policies, bureaucracy, and profit motives, leaves little space for courage or dissent. That's why stories like Dr. Shelikov or Dr. Hamzoğlu are so rare. In 1964, Dr. Ivan Shelikov from New York faced years of pressure from asbestos industry after he published research showing asbestos harms health, causes cancer. In the end, his work was proven right. Before he died, he said that science is not sufficient. We failed to protect workers, and now disease and death are resulting. We did not realize that was rather only in part of scientific, but at least an equal part of a political and social problem. I could have saved a lot of those boys instead of waiting. September 14, 2015, Dr. Hannah Atisha, a pediatrician at Hurley Medical Center in Flint, provided definitive evidence that the Cinder administration was poisoning over 8,000 children from Flint River. Their blood levels of lead had risen over 200% from drinking the top water. After press conference, she was immediately criticized by the administration, who called her research unfortunate and said she was responsible for creating near hysteria. In 2011, a doctor, Professor Onur Hamzoğlu in Turkey, faced similar harassment, plus the threat of jail for warning people about air pollution. He was a public health doctor, has been studying health problems in Dilovası, an area full of factories. His research found that living in Dilovası for more than 10 years makes people over 4 times more likely to die from cancer. He discovered heavy metals like lead, mercury, arsenic in breast of mothers and newborn babies' stool samples. Authorities denied the problem and accused him of spreading panic. The university started a disciplinary investigation claiming he shared incomplete research with the media. He put on trial and faced 2 to 4 years in prison. Of course, support poured in from other academics, students, and the public for him. I was also put on trial for defending Dr. Hamzoğlu through the protest. Do we need more doctors like Serikov or Hamzoğlu? If we need them, we need to create space for tough conversations, teach history, politics, and ethics, and encourage students to look beyond the hospital walls. 4 out of 5 medical students see unethical behavior, but most are too afraid to speak up, even if they know it's wrong. Biomedical education as a system of cultural indoctrination, training students to stay silent. First-year students may still notice injustice, but by third year, many stop seeing it at all. This kind of training ends up creating conservative medical providers. Health isn't just about biology. Many things affect our health, like environment, politics, money, culture, emotions. These all interact in very complex ways, either helping or harming our well-being. The neoliberal policies leave millions of people sick, injured, or dead needlessly. Gross inequality, social isolation, and alienation are endemic. Medical students are trapped in a rigid system of structured denial in their formal education. Medicine is too important to be left to biomedicine. We must publicly challenge the hierarchical pedagogies of the medical, industrial, pharmaceutical context and eliminate its hegemony. Medicine is potentially a force to transform the culture towards freedom, equality, and democracy. Lastly, as a doctor, I witness Gaza not only facing hunger, but a deliberate healthcare catastrophe. Silence is consent. Thank you very much for your attention.